Though the concept of sutureless aortic valve replacement was introduced several decades back, it was redeveloped one decade back based on experience with transcatheter aortic valve replacement. Initial randomized controlled trial used a stented balloon expandable valve with 3 guiding sutures and deployed through a minimally invasive upper hemisternotomy. Once the valve was properly seated, a 10-second balloon inflation was given and the guiding sutures were tied, followed by closure of aortotomy. They demonstrated significantly reduced myocardial ischemic time and better valvular hemodynamic function than full sternotomy surgical aortic valve replacement with a conventional stented bioprosthesis. Currently, 2 types of valves are available. One has a self-expandable nitinol frame, while the other one has balloon expandable stainless steel cloth-covered frame. A recent review of the topic gives us a lot of insights on the option of sutureless surgical aortic valve replacement. Some studies have reported lower transvalvular gradients and lower incidence of mild aortic regurgitation, lower cross-clamp time, and cardiopulmonary bypass times with sutureless valves. Shorter lengths of hospital stay were also documented. There was no difference in 1-year mortality between sutureless and conventional valve replacements. Paravalvular leaks were equivalent or higher with sutureless AVR compared to conventional surgical AVR, but lower than transcatheter aortic valve replacement. Paravalvular leak was also associated with operator experience and is expected to decrease in future. Stroke rates were similar between sutureless and conventional surgical AVR. Compared to transcatheter aortic valve replacement, it was equivalent or lower. Rate of permanent pacemaker was higher after sutureless AVR compared to conventional surgical AVR, but lower compared to transcatheter aortic valve replacement. Factors favoring sutureless AVR may be high-risk patient, redo surgery, difficult access, calcified aortic root or ascending aorta, or prior homograft or concomitant procedures.